Know your mental health rights. Be your own advocate. You have voice and choice in your healthcare decisions. Brought to you by NAMI Yavapai County. You can find this and other mental health rights documents at mentalhealthresources.org. You can find definitions of terms and acronyms mentioned in this video at mentalhealthresources.org. Laura, thank you so much for joining us today.
Thank you. It's a pleasure to be here. And today I wanted to talk about rights specific to people who are in Medicaid managed care systems. And that would include anyone who has access as their health insurance. And specifically, the right we wanted to talk about today is the Medicaid right to choose healthcare providers from the Medicaid managed care plans provider network.
Laura,
Yes.
sometimes I've read the right and my provider won't let me make a choice.
That's not okay. If the provider does, it's a right, it's an absolute right to make a choice within that provider network. And if someone is not honoring someone's right or ignoring their right, then there's an opportunity to complain to the managed care organization and to Access, because this is a right guaranteed by Access, the state Medicaid agency. And if someone is violating that right, Access needs to know about it. And within this presentation, we have the phone number where you can contact Access for assistance in ensuring that your rights to choice are enforced.
But I'm a little concerned because, my provider might come back and deny me services and they might be upset if I report them.
It's illegal for the provider to retaliate. And if you're concerned about retaliation, you may want to go directly to Access if that's a concern about contacting the health plan directly. As an Access member receiving behavioral health or other Access services, the Access Member Handbook on page 81 gives you the right to choose a primary care provider and other providers from the Access Managed Care Organization's network list. You have the freedom of choice among providers within the managed care organization's provider network. You can choose any of the. Yes.
Excuse me. I asked my provider to send me to a peer run, and they said that they offer peer support. And I want to go to a peer run, not see peers in my own health home.
It is your right to choose. Every regional behavioral health authority has peer runs as part of their provider network. And it is your right under the Access Medicaid program to choose a peer run as long as they're part of that health plan's network. And sometimes the staff may not be aware of the rights of members. And I think you can go to the you can go to the member handbook to page 81 and show them in the section of member rights that it is your right to choose within the provider network. They may not be aware of that, but your right, the right of choice, supersedes other requirements. You have the right to be treated fairly and have equal access to all medically necessary covered services within the managed care organization's provider network. You have equal access. Having choice of providers means access to providers.
I'm not sure what you mean by managed care organizations. So I have a health home. So what are the managed care organizations?
So the managed care organizations do not directly provide services. That's the main difference. They're basically insurance companies. So the managed care organization, these are like Blue Cross Blue Shield of Arizona, United Healthcare,
Okay,
Care First. These are the big insurance companies that are not that they don't provide services. The service providers tend to be the health homes.
okay.
Okay, and for integrated health homes, you can choose.
Well, then how do I find out who these providers are? I mean, how, is there a list?
Managed care organization should be able to provide you a list of all the providers in their network that they contract with. And from that provider list, for services that have been determined to be medically necessary for you, you get to choose the providers who you're going to receive treatment or other services from.
Okay, so I have an ISP. And my provider, I have said that I wanted on my ISP to be referred to a peer run. Is that how I do it? Or I just go and tell them I want a referral?
You can ask for the referral. If the services that a peer run provides are part of your service plan, and the peer run is in the provider network, you can absolutely ask to receive a referral to that peer run organization.
Well, the people that make my ISP, they haven't updated it. I told them that I want a referral, and I don't hear back from them.
I would suggest reaching out to the member services of the managed care organization, because they're the ones who are under contract with those providers. And then if you're still not able to have access to that in-network provider that you choose, and because the managed care organization won't provide you with that access, then I would recommend you contact the state Medicaid agency, Access Healthcare, Arizona Healthcare Cost Containment, and there's a phone number within these slides on how to reach Access. And Access members are required to have choice of in-network physical health providers such as primary care, and choice of in-network behavioral health providers such as doctors, clinics, counselors, case managers, and other treatment or support providers. Access does not allow health homes to limit services only to the health home. The health home must allow member choice of providers. That's a requirement by Access of the health homes. Access requires that services may occur within or outside of a health home. A health home cannot limit you to seeing only the health home's providers. That is not allowed by Access policy or Access contracts. You have choice of all providers within the network, not just the health home providers.
So, okay, so my family would like to go to like Family Involvement Center. But they went there, but then the health home wouldn't send my information. And so I never really got to keep going to people at FIC.
When there's a disconnect like that, first go to your health managed care organization, whether that's Blue Cross Blue Shield or Mercy Care or United. First go to that insurance company and let them reach out to the provider. Sometimes they can get things done more quickly. And then if there's still a delay, if they're still not providing you with the service that you're requesting, then I would recommend going to the Access Clinical Resolution phone number and contacting Access and letting them know that your right of choice is not being respected. And they will help. They will help you with that.
So as a peer, my peer support that works with me said that having a choice is part of recovery. It's part of that recovery process. And And I have tried very hard to make choices, and sometimes they're not the best, but I do feel better when I'm allowed to make a choice and participate in my own treatment.
Absolutely. Absolutely. It's a cornerstone of the Medicaid program that people have choice. Access to care means choice of providers. They're one and the same. And to have easy access to care and to be able to shape our destiny and feel comfortable with the people that we're providing the most intimate and personal information about ourselves with, that requires that special trusting relationship where we choose who we trust. We choose who our providers are. And that is the foundation of the Medicaid program, and that is the foundation of the Access program in Arizona. And it's a right that will be enforced by the state Medicaid agency, ultimately, and the federal government.
I feel this makes me feel respected. This makes me feel good that there is some kind of respect, and people have to recognize me as a human being.
As a member of the community and as a member of our culture, we get to choose these things. Everybody gets to decide for themselves. We know best what works well for us. I think that's such a key thing, is that respect, and we need to put that in more. Access also requires that members shall be offered the option to receive medically necessary behavioral health or other services from a peer-run organization or a family-run organization. But it's all service providers that you have a choice with, that you may choose from. You may choose for counselors throughout the whole system. There's the opportunity for choice. Now, if you believe that you're right to select a healthcare provider from the managed care organization's list of in-network providers, if that right you believe has been violated or ignored, first contact the Access Managed Care Organization and request to file a complaint. If your rights still are not being honored, contact the Access Clinical Resolution number at 1-800-867-5808 and let them know that you're seeking to exercise your right under the Medicaid program to choose your provider.
You know, this is kind of scary to talk to people that I don't know, but this is part of my recovery and things that I need to learn to assert myself.
Yes, rights, like all rights, if they are not protected, if they are not exercised, if they are not nourished, they can go away and be forgotten about and not be respected. But just like all other rights, sometimes we have to demand our rights and be an informed consumer, as part of our recovery, as we live in the community and how we demonstrate respect and care for one another. My name is Laura Hargroves, and for many years I was the network development director for one of the regional behavioral health authorities. Before that, then I wrote healthcare regulations for licensing at the state health department. I'm now retired and working in Arizona to make people aware of their rights under Medicaid and how they can exercise those rights.
My name is Kathy Basher, and perhaps you heard my voice during the video. And these are questions that I had when I was a peer receiving services in the system. And they've always stayed with me, these concerns. I went on to become Bureau Chief of the Office of Individual and Family Affairs at Access. I'm now retired, and I've devoted my life to ensuring all of us as community members have choice. It is just part of recovery.